Local health experts are stressing the importance of vaccines in kids that are eligible. This as the first few weeks of school wrap up. KAMR Local 4's Jack Kessler has more on the risk kids can face when getting those vaccines.
Dr. Todd Bell, Amarillo Public Health Authority, says compared to last year, more and more kids are getting and becoming sick with COVID-19. Dr. Bell adds that it's still rare for kids to become hospitalized with COVID-19. He adds some of the symptoms kids face can be different from adults.
There's something called misc that people may have heard about. It's an uncommon reaction to having had a COVID infection. And it seems to be something that happens perhaps more frequently in children. Certainly the C part of it actually stands for children. So we see that kids with misc can have significant issues with breathing. They can have heart problems, kidney problems, liver inflammation. They oftentimes need to be put into the pediatric intensive care unit.
Dr. Bell says those kids that are eligible need to get vaccinated to protect themselves and others. He says the symptoms kids can face from getting the vaccine is the same as adults.
Kids can get a low-grade fever. This can last for even up to 24 hours sometimes. They can get muscle aches. They can get headaches. These are the same types of issues that we see with other types of vaccines as well. So really not any different. Now, I will point out that there is a risk of something called inflammatory myocarditis, which is basically inflammation of the heart muscle that occurs in about 1 out of every 100,000 people who get one of the mRNA vaccines. It's something that usually we're able to treat in kids with just a ibuprofen, and then we're actually able to send them home.
Dr. Bell adds that kids have a higher risk of getting inflammatory myocarditis by COVID-19.
It's worth noting, though, that the virus itself has about a 1 in 50,000 risk of causing the same thing, except that it tends to be more severe, and those kids end up in the pediatric intensive care unit.
Dr. Bell also stressed the importance of kids wearing masks in school, as if kids aren't, it could lead to more kids being infected and lead to children being hospitalized. Live in studio, Jack Kessler, KMR Local 4 News. Judd?
All right, Jack, thank you. Dr. Bell says on average, an average kid has about 50 interaction with other people a day.